Hello, everyone. Today I just wanted to tell my story about my hysterectomy, what kind of hysterectomy I had, and what the recovery was like. Uh, while it is still fresh enough in my memory before it starts getting foggy, it's been about 7 months now that I've had my hysterectomy, a little over half of a year. And I also wanted to mention, if you're wondering what this thing is on my head, I'm wearing an acne sticker because I got some goddamn acne. It's pretty cute, right? So there are three main kinds, like methods of hysterectomy that I am aware of. Those are abdominal, laparoscopic, or vaginal. And also, warning, I'm going to be using all kinds of anatomical terminology here, but we're all trans bros here, so hopefully it'll be okay. I ended up having the laparoscopic hysterectomy. I initially wanted to have the vaginal hysterectomy because of having fewer or potentially no scars whatsoever, because it can have a decreased recovery time, an easier recovery. But I ended up going with laparoscopic instead because the biggest predictor for having the fewest complications and having the smoothest surgery is not what type of surgery you have, but really surgeon experience with the method of surgery. And my surgeon initially had agreed to do the vaginal hysterectomy with me. And a week or so before surgery, she was actually like, hey, maybe could we do laparoscopic instead? Because I do like 30 of those a year. I'm really experienced with it. I'm the most comfortable with it. And I was like, yeah, it seems reasonable to me. And so something I want to show you guys right now is, since it's been 7 months, what my incision scars look like. My surgeon was super fucking awesome and good at what she did, and she definitely prioritized, like, she wanted my scars to be small, and they are super goddamn small. So here's the biggest scar. It's about an inch wide, and it's not very noticeable. I mean, like, my veins and my pale skin are like about as noticeable as a scar. Here's the other scar. It looks like a dot. It is nothing. The third incision was in my belly button, and so you can't really see that. So with laparoscopic, there will be between 3 and 5 incisions. I had 3 incisions, and I'm really happy with how small they ended up being. And I'm only 7 months post hysterectomy, so odds are, like, those scars are going to be, like, completely invisible. Like, for me right now, they're already, like, not noticeable. So I'm really happy with how that turned out. Another thing I did want to mention is that laparoscopic is probably the most common. Vaginal is a little bit less common. And abdominal, from what I understand, abdominal is usually going to be used in, like, an emergency situation. From what I understand, it's usually not the go-to method. Abdominal actually, from what I understand, cuts through those abdominal muscles, which leads to a much more intense and long-term recovery. The cool thing about, like, laparoscopic is that the incisions are very small, and I'm not really sure how it works, but the tools that are put into the incisions are also very small, and they don't have to cut through any of your muscles, which leads to a decreased recovery time, which is really good. Okay, so we talked about methods, but there's also, like, the type of hysterectomy. You've probably heard terms like a total hysterectomy. Like what do all these words mean? Instead of worrying about, like, the terminology of, like, a total, a partial, a complete hysterectomy, it's better to just talk about, like, what parts do you want to keep and what parts do you not want to keep. So for me personally, I felt that keeping my ovaries would be a good idea because I do not trust my legislature to make decisions that are good for my body. I was really scared, and I am still really scared, that I could have access to sex hormones that I need to keep my body healthy taken away from me, legislated out of my hands. And if that happened, I don't want to be in a situation where I don't have a backup. If I have no testosterone and also no access to estrogen, and I don't have gonads in my body producing a sex hormone to keep me from getting osteoporosis and other issues, I just, the risk wasn't worth it to me. If I could know for a fact that I would never lose access to exogenous sex hormones, especially testosterone, then I totally would have gotten rid of the ovaries. But with the political climate, with being the scapegoat of the decade, I just wasn't comfortable with doing that. So I kept my ovaries. Hysterectomies are super customizable. So it's just, what parts do you want to keep? It's good to like learn about your anatomy and figure out like what parts do what, so you can know which parts you might want to keep and which parts you might not want to keep. I got rid of my cervix. And one of the reasons for that is because a priority for me was to not have any bleeding anymore. Bleeding for me is like super dysphoria inducing. It's something that I do not tolerate very well. And if you choose to keep your cervix, there is a chance that you could still have some bleeding and some spotting. And that's just not something that I wanted to go through ever again. And another benefit of getting rid of the cervix is that you no longer have to do pap smears. Your doctor is still probably going to recommend that you come in to do a pelvic exam about every year or so, because I don't know, I guess to check on things. I'm trying to think of like, if you no longer have a cervix or a uterus, like, and you don't have to get pap smears, and you're not going to develop cervical cancer because there is no cervix to develop cancer. Like, what are they looking for? I guess atrophy. There could be other problems with the vagina, but I'm not really sure. I did, of course, get rid of the fallopian tubes because, like, why would I need them? Why would I need those? So here's what my body is like post-hysterectomy. There's a vagina. There is no cervix. The top of the vagina is like, they remove the cervix and then they sew it together. They call it like the vaginal vault, I think, at that point. And that tissue is what can bleed a bit during recovery, which I'm going to be talking about because I had some trouble with bleeding during my recovery. So no cervix, no uterus, no fallopian tubes, but I've got some ovaries. I have both ovaries. If you want, you can just get rid of one. And another thing that I want you to know is that if you talk to the right people before your surgery, if you set this up beforehand, if you plan ahead, you can get your uterus taxidermied. You can keep it. From what I understand, it's like you want to reach out to like a taxidermy company and see if you can find somebody who would be willing to do that. And then you have to get them in contact with your surgery team. And so that communication, they can like, I don't know, do they freeze it? Do they put it in like a special like biohazard container and then they get it to the taxidermist? I don't know, but I have seen people who have kept it, and I think that's awesome. It's hilarious. It's punk as hell. And if I had known that that was a thing that I could do, then I totally would have done it. But yeah, it's just to let you know that is something you could do if you wanted to. One of the other things that I wanted out of my hysterectomy, of course, I didn't want to have to deal with the potential of pregnancy anymore, because that was something that was just like a non-negotiable. That was something that for me and my body was it's just wrong for me, incredibly wrong for me. And I live in Missouri, and the month before I had my hysterectomy, Missouri, it became illegal to have an abortion in Missouri, which is real goddamn spooky. And I'm glad that I hurried things along. I could see what was happening. I saw the potential for Roe being overturned, and I got ready and I sped things along. To be honest, like, I would have liked a little bit more time to think about it, but I am glad that I got it over with, because accidentally getting pregnant as a trans dude with reproductive dysphoria in a state where abortion is illegal, yeah, that's like a really dangerous mix of things. So anyway, there's like the huge relief of never having to worry about pregnancy ever again. I had like a bulk package of pregnancy tests, and I got to donate those because I don't need them anymore. I can't get pregnant. I got to donate a bunch of pads that I'm never going to use. And one of the things that I wanted to get out of my hysterectomy, which I did get, is that I used to have some cramping, just like random cramps that felt like period cramps. And this is not uncommon for people on testosterone. And from what I could gather and from what my surgeon could gather, this cramping was most likely from uterine atrophy. I talk a lot about atrophy on this channel. And so the condition of atrophy doesn't just affect the vagina. It's called genitourinary syndrome of menopause. That's the full name of it. Really, I think that genitourinary syndrome of hypoestrogenism would probably be a more accurate name. But I mean, like, it's fine. Basically, the idea is that a lot of your reproductive organs and your urinary system can be negatively impacted by a lack of estrogen. Whenever you're on testosterone, your estrogen production decreases very significantly, and that can cause some health issues. And it's not the same for everyone. It's not really bad for everyone. For me personally, I did have some problems though. And even though I was on a topical estrogen, it wasn't enough to prevent these cramps that, from what I understand, were associated with uterine atrophy. And my surgeon was actually able to confirm for me whenever she went in and did the surgery. After I woke up, we were chatting, and she told me that my uterus was atrophied. It was just kind of small and like squishy. I don't know. She said he was a gloopy little guy. That's the words that she used. She was she's awesome. She's really silly. So anyway, yeah, one of the benefits that I was looking forward to after having the hysterectomy, I was really hoping that having the uterus removed would prevent these cramps. And after I woke up from surgery, the cramps were gone forever. And just to give you a little bit more details of what these cramps were like, they felt like menstrual cramps, and they were very often triggered by sexual arousal or like stimulation or climax. So anytime I was doing sexual stuff, I guess it's just that there's like your pelvic floor muscles engage, and that those muscle contractions, if your uterus isn't in very good shape, then those muscle contractions can hurt a little bit. From like I do want to say that I'm not a doctor, and I don't even have a bachelor's degree. This is just, I'm autistic and I like reading about how my body works, and this is from what I understand, what I believe was going on according to my surgeon and according to what I've read. And before my surgery, I told my surgeon about these cramps and was like, hey, do you think it's like 100% going to go away? Do you think these cramps are definitely caused by uterine atrophy? And she said, it could be the uterine atrophy, or it could be pelvic floor dysfunction. So if you have the hysterectomy and you still have these cramps, then doing some therapy for pelvic floor dysfunction is a good option. So if you're on testosterone or having some other kind of hypoestrogenism, it's a possibility that uterine atrophy is the cause of your cramps. It's a possibility. Okay, so the next thing I want to talk about is what the actual recovery was like, what like the pain levels were like, and energy levels, and how long it took for me to start feeling like I was back to normal. And before we get into that, I do want to point out that I am legally disabled by PTSD and depression. And if you know very much about mental illness, especially PTSD and depression, you can have somatic symptoms. It can affect your body. It can make you very tired with no apparent physical cause. I have been doing tests with my doctors for the last couple of years trying to figure out if I have like chronic fatigue. But every test that we do, it just seems like everything's normal. And so the fatigue and the body problems that I experience seem to be caused mostly by PTSD. And right now I'm doing a lot of work on my PTSD right now. I'm doing cognitive processing therapy. That's not relevant for this video, but hopefully I will see some alleviation for the PTSD in the near future. But I did want to let you guys know that like I already have fatigue problems. So the fatigue problems that I had with my hysterectomy might not be normal for a lot of people. I have read a lot of accounts and some studies online from other people who've had hysterectomies, and sometimes the fatigue can be pretty bad. It is a pretty major surgery. But for some people, they're like, oh yeah, like a week later, I was like back to normal. It was like nothing happened. And so like I had seen so many people say that they felt back to normal in about a week and a half that I was expecting that to happen to me. And especially because with my top surgery was really easy. My top surgery was about 2 years before my hysterectomy. And, there wasn't a lot of fatigue. There was very minimal pain. I tell people that the most painful part of my top surgery was the constipation from the pain medications, because it really was. It was a very easy surgery. Nothing went wrong. And I was in very little pain, very little distress, and my energy levels, I just felt like I wanted to get up and do shit like right after I woke up, and I was like that pretty much the whole time while I was recovering. But it wasn't like that with my hysterectomy. I had a whole lot of problems with some pain, with bleeding unexpectedly, and with fatigue being real bad. Like fatigue so bad that like if the house was on fire and I needed to get up and get the fuck out, like I probably would have needed help getting up and getting out. I was excruciatingly tired for a few months. But I'm going to start from the beginning and give you all the details, tell you what the surgery was like from the beginning. So, the first thing I want to mention is pre-surgery. I had to get there at like 5 or 6 in the morning, and the actual surgery wasn't until 10 in the morning. And it's amazing how fast time goes by when you're like getting ready for surgery. So I got there and they had me get into a prep room, got into a gown, and I had to use like these antiseptic, antimicrobial body wipes all over my body to get myself nice and sanitary. I also asked my surgeon before my surgery, like, hey, I'm finally growing some tummy hair and I'm really proud of it. Are you guys going to have to shave my tummy hair? And she looked at my tummy and she was like, no, I think I'll be able to leave your tummy hair. And I was like, yes. And she totally left my tummy hair. Not a single hair got shaved from my tummy, which made me really happy. So, I did all those wipes, and all of the nurses and like my medical staff, they were pretty cool. except for one person. I do also want to mention that this surgery took place in a women's and children's hospital, which, like, you know, that already kind of sucks a little bit. The name of it was a little bit uncomfortable, I think, for a lot of trans guys. Like, I wasn't excited about it. And I was worried that because of the name of the location and their focus of their demographic, that I was going to get misgendered more. Whenever I had my top surgery, I did not get misgendered at all, because it was like a priority of the surgeon and his staff that all of the patients were never misgendered. So, like, you know, I was only like about a year on T. I didn't look as passing as I do now, but I didn't get misgendered at all when I was in that hospital talking to that staff in San Francisco, California. But this is Missouri. And so things were a little bit different here. And I unfortunately did have to work with somebody on my care team who was transphobic. And I caught her before my surgery. You know, pre-surgery, it's kind of a priority to help make the patient comfortable, help make sure that they're not panicking. A lot of the time they'll prescribe a little bit of like Ativan or something before you're wheeled in, because going into surgery is a big fear of a lot of people. Even if you're pretty comfortable and confident and like it's a routine surgery, a lot of people get really scared. And so it is a priority to make sure that the patient is comfortable. You know, a really good way to make a trans patient uncomfortable is like 5 minutes before you wheel them into surgery, misgendering them repeatedly and intentionally, and doubling down when they call you out on it. So this lady was talking about me. She was like, oh yeah, we're going to be wheeling her in soon in about 5 minutes. And I was like, oh, hey, I think you might have called me she on accident. I'm a guy. And then she said, no, I didn't. I was talking about someone else. I'm just like, I hope that you're not talking about someone else, because you're on my medical team about to take me into surgery. Like, she just dodged accountability and was like, nuh-uh, did not. So it's upsetting and distressing, because I was polite. I politely corrected her, and then she continued to call me she, her, like as many times as she could. Was calling me a lady in the last couple minutes before I got wheeled into a major surgery, which, like, it's a little bit scary. You know, like, you might think it's not a very big deal. If you're not a trans person, you might not think it's a big deal. But, like, this person is going to be in the room with me while I'm under anesthesia and my body is cut open. And she doesn't like trans people. She's made it clear to me that she does not like trans people. And it, like, I trusted my surgeon so that I knew that I would be safe, but it kind of made me worry that, like, man, like, this lady has some control over my health and my life right now. So that's obviously a little bit distressing and a little bit alarming. If I hadn't, like, trusted my surgeon so much, if my surgeon wasn't like such an awesome lady, then, like, there's a possibility that I would have just, you know, like, put my foot down and said, hey, I'm not going to get the surgery if I have to work with this person who's intentionally misgendering me because I fucking feel unsafe and uncomfortable. But anyway, after the surgery, my surgeon did tell me that this lady, I told my surgeon about this lady. I was like, hey, this lady is misgendering me. And she told me that during the surgery, that lady was doing that during the surgery. She was doing it the entire time. And man, it's just like, it's so unprofessional and so inappropriate and distressing. Like, if you're somebody who cares about your trans patient and you are trying to keep your nerves chill so that you can do a good job on their surgery, and somebody's standing there and disrespecting them like that throughout the entire surgery, like, could you imagine, like, getting worked up and you're like, I gotta stay calm down so that I can do this surgery. Like, that lady put me in a little bit of danger, actually. And I did end up reporting some people for transphobia after I was feeling well enough, several weeks after my surgery. And the patient safety or like patient complaint line, I don't know what it was. They actually took me seriously and called me back and told me that lady got in some trouble. And that's not the end of the transphobia that I experienced. I'm telling you guys about this because I do want you to be prepared that there is a possibility that you could experience some significant transphobia. Sorry, I'm getting stuttery because like remembering it is a little bit upsetting and nerve-wracking. I want to bring up my only medical complication, my only real complication that I had during my surgery. So one of the people on my medical care team pre-surgery came in and put an IV into one of my veins, and I have real goddamn tiny veins. I got tricky little veins, and normally they'll put one up here, but they couldn't make it happen. So they went for a vein that was running along my wrist here. And whenever they put it in, it hurt. And I've had a lot of IVs and a lot of blood draws in my life, and I've never felt one hurt like that before. So I kind of felt like maybe something wrong might have happened. And it turns out that I had like a vein injury. So after I woke up, there was like a little knot, like a hard little rock-like thing in my wrist, and it lasted for several months, but I think it may actually be gone now. Apparently, like little injuries that cause your veins to scar. And I'm going to try and insert a picture here as well, because I had some good pictures of my vein being like super swollen, and it looked weird and it felt weird, but I was assured that it was okay. It was not going to be harmful to my health. So that's my only real complication, I guess. So I got wheeled into a surgery room. I was like laying on one of these little bed table things, and it had wheels, and they like pushed me into a different room. And I don't really remember being in that room because the anesthesia did its job real quick. And I woke up, I guess, a couple hours later. And I want to tell you about the most physically painful part of my hysterectomy. So when you go under anesthesia, whenever you're having a lot of surgeries, you will have a catheter. And post-catheter pees often do not feel very good, but it was a little bit worse than the regular post-catheter pee, because at the end of the surgery, after everything was done, what my surgeon does to make sure that like nothing was damaged, like to make sure that the bladder didn't get poked or cut during the process, she puts a camera, a very small, I don't know how big it actually is, but they put a camera into your urethra, and they look around inside of the bladder to make sure that there are no injuries to the bladder, which is a good idea, a good precaution, and I'm glad that they do it. But, I woke up, and after a little while, I was ready to go to the bathroom, and the first time I peed, dear God, it hurt so bad. It was like actually a 10. It was like a burning, stinging pain. As long as pee was coming out, it was burning. And I think there was like a bit of blood as well. But you might be surprised to learn that there was not really any blood coming out of the vagina. I was like super prepared for it, and I had like brought a bunch of pads and things, and I was like, that's probably going to be bleeding a little bit, right? Not really. And I I guess when I thought about it, like when I had top surgery, like it's not really normal for your incisions to bleed. The vaginal vault, the top of the vagina where it was sewed shut, where the cervix used to be, it wasn't really bleeding. There's only like a little tiny bit of spotting. And so like when I did wake up from surgery, I was in a pretty good mood, but the nurse who was helping take care of me was misgendering me, and I had just woken up from anesthesia, and I was already in a bad mood from the other person on my care team misgendering me. So I looked over to my girlfriend and I said, "Hey, is she talking about me? Because nobody calls me a lady. I haven't heard somebody call me she in a long time. Like, I don't even know if she's talking about me." And then she was like, "Oh shit, I'm so sorry." And it's like, bro, I get it that people make mistakes, but my name, like, you can see the patient's name. You can see Oliver, male. That is what it says on my patient profile. It says a guy's name, and it says the letter M, where the gender marker goes. And it's just, mistakes happen, and under other circumstances, the mistakes don't bother me as much. But when you're at your most vulnerable and you've just had a major surgery, and after somebody was just intentionally misgendering me, I was at my limit and I was not having any of it anymore. And honestly, the transphobia that I had to deal with, accidental and intentional, was pretty bad. And it negatively impacted my mental health throughout my recovery. And that's something that I'm, it didn't need to be like that. It didn't have to be like that. And like I said, I did end up reporting some people afterwards, and the patient complaint line took me seriously, and they told me that they are doing trainings now to help make sure that their trans patients don't undergo this type of mistreatment again. Hopefully, I'll be the last one, but like, I don't know if that's going to be the case. So anyway, I woke up and I was, aside from the misgendering, in a pretty good mood, and I felt alert and awake and energized, and I didn't want to stay very long in the hospital, so I was like kind of eager to go. And I had a few milestones, like, hey, if you go to the bathroom by yourself, if you eat a meal, if you seem like cognizant and stuff, and you hang around for a few hours, then you can go home. And after getting misgendered by people too, like, I didn't want to stay in the goddamn hospital. I didn't want to be around these people. So I went home earlier than I probably should have. And I started feeling unwell after I got home. So I got sent home and I was put on a few pain medications. I was on just some NSAIDs like ibuprofen every few hours, as well as oxycodone, which is an opioid. And I had been on other opioid medications in the past, so I thought that it wouldn't be a problem for me, but it ended up very much being a problem for me. And I'm going to show you guys a video that I recorded when I was recovering from my hysterectomy. I think this was like maybe 24 to 48 hours after I had gotten home from the hospital. Okay, friends, I'm going to make a little update real quick about how recovery from hysterectomy is going, and so far it is going bad. It's not good. I've barely gotten any sleep, partially because I'm in a lot of pain and it's just hard to sleep through it. And it also turns out that I've been reacting badly to my oxycodone. It makes my entire body itch, but it's not like I'm allergic, it's just a side effect can be itching. And it's also giving me mild hallucinations, visual and auditory, where I just keep thinking, oh my god, there's a bunch of blankets on the bed, and it's definitely some random person is on my bed. I'm really scared. I keep hearing, like, people having conversations, and I'm like, no, there's no other people in my house. Sorry. So as you can imagine, in the state of vulnerability of already being post-op and being in pain and not being able to sleep, having hallucinations was really goddamn scary. And, you know, like, I already have PTSD, so I have an exaggerated startle response. It's really easy for me to get scared. And I kept getting really goddamn spooked at a lot of things that I saw in my house. My cats have, like, a laser toy that's automatically activated by motion if somebody walks by. I remember at one point in the middle of the night, I couldn't sleep, and I got up and I walked by it, and then I saw a laser go by me on the carpet, and I got so scared that I almost fell over. Like, I probably should have stayed in the hospital a little bit longer. It's just, I couldn't have predicted, and nobody could have predicted that I was going to react badly to the medication. So, it's probably a good idea for you, if you are going to be doing any kind of surgery, learn what medications you're going to be put on after the surgery during your recovery, and learn what some of the side effects are like, so that if you have a weird side effect, that you know what's going on, and you know that you can stop taking the medication. Even though I was in pain and I wanted to be on a prescription pain medication, it just wasn't a good idea for me because of those side effects. Wasn't going to be able to get any sleep, and I just felt awful. I just felt like I had, like, really clouded thoughts, and yeah, it was really bad for me. It was just really bad for me. So learn the side effects of your medication so that you can stop taking them. I ended up stopping taking the hydrocodone as soon as I realized that was what was causing those symptoms. And again, it sucked because I was in a fair amount of pain. It was like a pressure pain where if you got into certain positions or you did certain things with your body, then it would hurt pretty bad. So I would have to stay lying down in a certain position and just, like, not really move for as long as I could. And this lasted a few days. And I could only manage that pain with NSAIDs, with over-the-counter pain meds, because I was reacting badly to the pain medication that they had given me. And, you know, you might be thinking, why didn't you just call them and get put on a different pain medication? You could have gotten something besides hydrocodone, but something a little bit stronger. And yeah, I could have, but that would have meant calling the Women's and Children's Hospital and saying, I had a hysterectomy and I need different pain medications. And that person on the phone every time would assume that I was a girl, even though I have not been misgendered on the phone because of how my voice sounds. I haven't been misgendered on the phone like at least 6 months or maybe a year before my hysterectomy. And it started happening again because of the context of, I'm a patient who had a hysterectomy. Everyone who answered the phone was like, ma'am. Yes, ma'am. Because, you know, in cis people's brains, it's just every person who has a uterus or every person who has a hysterectomy is a lady. And that's a genuine barrier to accessing care. It is a genuine barrier. When I have to face that distress of being misgendered, when I'm already in pain and I'm already tired and vulnerable from undergoing a surgery, yeah, it really sucked. So there were a lot of times, because of that incident of getting misgendered and knowing that I was going to get misgendered again, that I would avoid making calls and contacting my doctor when I knew that it was a thing that I needed to do. So the first few days, pretty rough, pretty goddamn rough. And I want to show you a cute little picture, a cute little selfie I took of me after I woke up from surgery. Look how cute I was. Look at me with my Dragon Ball Z Trunks hair that I was doing at the time. Femboy Trunks was my aesthetic over the summer. After I took that picture, like, I was in a pretty good mood, and I was like, yeah, I'm done with my surgery. This is gonna be so easy, you guys. But after I got on the oxycodone, I felt like dog shit for a little while. Let me try to find a picture of what the swelling, bruising, and what like the incisions looked like right after I woke up from surgery. Here's a picture of my tummy, July 29th, so it was about a week post-op, and a lot of the swelling and bruising had gone down. You can see like a little bit still on there, and like the incisions are more noticeable, and if you see some stuff on there, there was a lot of glue, like surgical glue applied to keep the incisions closed. If you don't want to see what my stomach looked like right after surgery when I woke up, and it was all still like really swollen and purple, there's a little bit of blood, actually, a little bit of blood underneath the incision, so look away if you don't want to see that stuff. Here's my tummy. You can see the shiny stuff, the plasticky, shiny looking stuff is glue, and one incision was in my belly button, so my belly button was covered in glue. It felt really weird. It just felt like there was a gob of hard plastic stuck inside my belly button for a few weeks until it was gone. And as you can see, all of my tummy hair was unshaved, which is very cool. I think this picture makes it really obvious how much swelling there was on my stomach. Like, I have a little tummy, but it's not like this. So my stomach was pretty swollen. Oh, the most annoying part about the glue, honestly, is that some of my tummy hairs were stuck inside the glue. I'm not holding back on any information in this video, and so like one of the details that I want to let you guys know about is sexual stuff. You probably have some sexual questions about post-hysterectomy stuff. One thing I want to mention is that there have been some studies on the length of the vagina after having the cervix removed, and it is typical to lose a couple of centimeters of length. But the problem with those studies, from what I remember, like, it would be like a few weeks post-op, maybe like 6 weeks post-op that they did the post-op measurement. And as you probably know, during arousal, the vagina will expand a little bit, get a little bit longer, accommodate a little bit more room for activity while there's some arousal going on. And something that you might know about scar tissue is that whenever scar tissue is new, it's more stiff, it's hard, it's not malleable. And so from what I have read from other people's accounts and from surgeons is that the loss of length in the vagina post-op, if you have your cervix removed, can be temporary. It's not necessarily going to be like a long-term thing for everyone. It's that scar tissue that's formed. It can take a little while for it to become malleable again so that the vagina can expand as it normally does. So there's a possibility that you could notice like that is a risk that I would want people to be aware of, that if you do PIV intercourse, then there is a possibility that you could lose a little bit of length temporarily or permanently. Most people seem to agree that the cervix is not really necessary for good sexual function, but I have read some people feel that they have lost some sexual function after removing the cervix. So that's kind of one of those things that you're gonna have to like make a decision on. One of the things that a lot of people find beneficial about removing the cervix in terms of sex is that the cervix getting poked during sex, for most people, does not feel good. Usually actually hurts. So removing the cervix is really cool because you no longer have to deal with that discomfort if you have an endowed partner. I will tell you that my partner did notice like a little bit of like shortening and a little bit of stiffness at the top, maybe like the first few weeks. So 6 weeks post-op is when I was cleared to do internal sexual stimulation again. So like the 6 week to 10 week mark post-op is when sex didn't quite seem the same for a little while. After that, for me personally, it seemed normal or a little bit better than normal because not having to worry about the cervix getting poked is nice. Not having to worry about pregnancy, really nice. I want to talk a little bit about what the post-op pain was like and what you can do to help like minimize it a little bit. Something that my care team gave me was like an abdominal brace, and they were like, it's totally optional if you want to wear it or not, but it can give you a little bit of support for your abdominal muscles, because one of the things that causes pain is whenever any of these abdominal muscles activate, if you're using your core muscles to support your body, then that's often gonna hurt a little bit. So it's Velcro. This is the abdominal brace they gave me. I'm gonna try to put it on and show you guys. What the abdominal brace does for you, I didn't put it on very tight, but if you put it on a little bit more tight, is it supports your abdominal muscles for you. It helps do a little bit of the work for you and helps you keep more like a straighter posture. So something that I would notice with pain the first few weeks post-op, like I said, anytime I engage these muscles. So if I wanted to go from standing to sitting to laying, I would have to try to find a way to like keep this part of my body straight and like use my arms to lower myself down or use my arms to pick myself up. And I had to do that for probably about like the first 2 weeks. And another thing that I noticed with pain is whenever I would laugh, cough, or sneeze, these muscles clench up, and that shit would hurt. I think I had like a little bit of allergies or something at some point, and I was sneezing and coughing a little bit, so I started taking allergy meds. And I think I started taking a cough suppressant just because like coughing hurt a lot, and I did not want to cough. The pain was typically pretty tolerable. If I was like in a good like rested position, then I wouldn't really feel very much pain at all. But if I was adjusting a position or if I was, getting those muscles engaged for whatever reason, that's when I would feel like a fair amount of pain. And it was frustrating because like sitting up would feel pretty uncomfortable. Like it's just like sitting on my butt would like put pressure on parts of my body where like I would just feel a pressure pain. So it would be more comfortable to either lay down or stand for like the first week. And eventually I started feeling well enough to sit up. It was really frustrating for me because the game Stray came out like a little bit after my hysterectomy, and before my hysterectomy I was like, oh yeah, I'm gonna like buy and download that game, and I'll have some stuff to look forward to and keep me busy. And I was too tired and too in pain to sit up and play a video game. This is a really short game. It was like maybe like a 3-hour long game, and it took me a few days to get through it because like, can you imagine what it feels like to be too tired to play a video game for like 3+ weeks? It was agony, actually. Something else I wanted to mention about sexuality post-op is that a lot of doctors, my surgeon personally, told me that it was okay for me to do external stimulation as soon as I felt like up to doing it. As soon as I was ready to do that, it was safe and it was okay for me to do it. And that might vary depending on what surgeon you have. But that is the recommendation that I had from my surgeon. And dear Lord, I was not prepared. I'm somebody who, like, I don't consider myself like a very sexual person. But during my recovery, I think the fact that I just wasn't allowed to have anything internal for 6 weeks, I think just being told that I couldn't made me want it more. And I just gotta say, the struggle of being like real goddamn wanting stuff when you couldn't, and when you were feeling bad and when you were tired, that was also something that was like a little bit extra distressing those first few weeks. And it was really cool when the 6-week mark finally hit and I was finally cleared to do PIV stuff. So the next thing that I need to tell you guys about is the bleeding, because I made the mistake of becoming too physically active during my recovery too early and causing myself to bleed a lot and putting my recovery in peril when I didn't have to do that shit. So here's what happened. I was miserable for about a week and a half. I had no energy. I was too tired to play video games. I went through the oxycodone hallucinations and itching and felt like dog shit, and dealt with the transphobia. And I just, about 1.5 weeks post-op, I had a little bit more energy. And because I had that little bit of energy, I wanted to do something else. I wanted to not lay down in one room 24/7 in the dark and just lay there. I wanted to do something else. I think that's a little bit understandable, right? And my neighbor asked me, here's the part where it's not understandable. This is some dumb shit. My neighbor asked me, hey, can you help me push this grill, a heavy barbecue grill, across the bumpy, grassy yard? And I was like, hell yeah, brother. I don't know why I agreed to that. Actually, I do know. I was really cooped up. I needed to go out. I needed to go be outside and do something. I wanted to be standing up. I wanted to be like physically active. I was tired of like being in this post-op recovery state. And so, like I had said before, there was very, very little bleeding, like vaginal bleeding the first few days. And after I helped push a heavy grill across the yard, after that, I started bleeding more. And, you know, I didn't keep doing active stuff. I got back to my rest, but I kept bleeding more and more every day until it was like a very concerning amount of blood. And so I called my care team, which I really didn't want to do because they were transphobic toward me repeatedly. And I told them I was bleeding a whole lot, and they were like, yeah, that's probably an emergency. You need to come into the emergency room and we will check you out. And I was in there for several hours. And let me give you some advice right now, which is any of these post-op appointments, if you have like an emergency visit or like on the hospital day, you should bring an extra pair of pants, stretchy, comfortable pants, extra pairs of underwear, pads, and something to wipe yourself down with. This was unprofessional the way they did this. I don't know if they were uncomfortable with trans people or if they were just too busy to like deal with me properly. But when they did a pelvic exam and it ended up being okay, everything was okay. And they told me, like, you need to not be so active. You need to just sit around, lay around until you're done recovering, because you have agitated the stitching at the top of the vaginal vault, and that's why you're bleeding so much. And if you had, like, I was lucky that I hadn't, like, torn any of the sutures or, like, Like I was lucky that I didn't injure myself or harm the outcome of my surgery, frankly. I shouldn't have been doing shit like that. So it made me bleed a whole lot for a little while. And like I said, usually what happens if somebody does a pelvic exam, a medical professional does a pelvic exam, if there is a bloody mess, usually they don't leave a fucking bloody mess on your body, but they left a bloody mess on my body, and they did not help. They didn't tell me there was a huge mess. They didn't warn me. It was just all over my legs, and like that shit was kind of upsetting and distressing. So anyway, I am lucky that I did bring a lot of stuff to help take care of myself and clean myself up afterwards. It was kind of shitty that they did that. So the bleeding was kind of bad for a while. But after I got back to resting for about a week, it went back to minimal again, and then the bleeding eventually stopped, and I have not bled again since my recovery time, since I was like a few weeks post-op. And that was one of my goals. That is one of the things that was like really important to me, was to stop bleeding. And that was one of the other things that made hysterectomy like really hard on me mentally, was bleeding gives me a whole lot of dysphoria. It really distresses me that is a thing that my body does. So if you are like me and bleeding is difficult for you to go through, like that's something you're definitely going to want to try to mentally prepare for. Yeah, it was really hard. So like I mentioned before, like I already have fatigue problems, I have depression and PTSD, and it's very possible that the reason why I had so much fatigue was because I already have fatigue problems. Either the surgery itself made the fatigue worse for me, or it's also possible that the distress of going through the bleeding and the misgendering, the emotional distress that I endured, that it's possible that is what made the fatigue so bad for me. But in terms of like how long did it take me personally to get back to normal? I remember a day, at least, I think I was about 12 weeks post-op, where I couldn't really get out of the recliner and I could barely like move my arms around. It was pretty bad. This level of fatigue, like I've had pretty significant fatigue outside of having surgery, but I had never had fatigue so bad that I was like, I couldn't move my body. And that happened a whole lot of times. You know, and the way that looked was like, I was in a recliner and my girlfriend brought me a bottle of water, and I couldn't pick up my bottle of water and like sit up and put it on the table. It's just, I was in the recliner and I couldn't really move, and I kept the bottle like on my body or like on my lap. And like I said, I have seen at least one study indicating that like this level of fatigue lasting like 3+ months, and the study was on cis women, by the way, in case that's relevant to any of you, that a significant number of people can have like real bad fatigue post hysterectomy for like 3 months or longer. It was around 4 or 5 months post-op for me personally that I finally started feeling like back to my baseline, which is a really long time. And like I said, again, there are so many people who I've seen who like they have hysterectomy, and after like a week or 2 weeks, they're like, I am 100%, I am back to my usual self. And that's just not what happened to me. And this is probably going to sound like a little bit sad to some of you guys, but like I've been disabled by mental illness since about I mean, legally around 2015 or 2016, I think. And so for me, feeling like garbage and being isolated in my home and not really being able to do a lot, that's like something I'm kind of used to. So it wasn't, like losing 4 or 5 months of my life. I didn't feel like it was a loss to me because I just am disabled, and that's just something I go through sometimes. It's like sometimes for several months, I'm really tired or I feel like shit, and I can't do things that everybody else can do, and it feels pretty bad. But this should go without saying, but I'm still really, really glad that I had my hysterectomy, even though it was really hard. And it was harder than it needed to be because of the goddamn transphobia that I dealt with. But I achieved the goals that I wanted, and I'm going to have these results for the rest of my life. I'm never going to have to deal with bleeding ever again. Like, yeah, I had to deal with like almost a month of bleeding, and it was very distressing. But I used to have periods from age like 12 until I started T when I was 26. And like now I don't have to do it. I don't have to do it ever again. I'm never going to have to worry about pregnancy ever again. I don't have to worry about those cramps anymore they're just never going to happen anymore. You know, if I had the knowledge now of how hard it was going to be, I still would have done it again. I still would have done it. I was caught off guard by how hard it ended up being. I didn't know it was going to be as hard as it was. And like, again, to be fair, like I already have some disabilities, and that's probably why it was so hard for me. And it's probably not going to be as hard as for other people as it was for me, but it was pretty goddamn hard. The last part of the story that I want to tell you guys is like the final kick in the teeth of transphobia that I endured with my hysterectomy. So, like I mentioned before, my medical patient profile has said Oliver, male, since I started transitioning in like August 2019. With no problems whatsoever. The purpose of this patient profile is not to identify a person's genitals, not to identify their gonads, not to identify whether or not they can get pregnant. It has nothing to do with the patient's anatomy. It has everything only to do with identifying the patient. And it also aids in helping smooth over like insurance procedures, as well as can help you predict pronouns a little bit better so that you can treat your patients with dignity and respect as one should. But that is what the purpose of this patient profile is. It is to identify the patient. It's not to put their genitals on display. That's just not what it's for. So anyway, you probably already know where I'm going with this, which is I went to my 6-week post-op appointment to visit my surgeon and get the pelvic exam and get the okay to see that everything's like good and that I'm in the clear and ready to go back to regular life stuff. I go up to the front desk, I check in, and they print off that little label with the barcode on it and my name on it, and it says Oliver, female. Someone who worked for the hospital, I don't know who did this, but without my permission, without any paperwork validating this decision, they went in and changed my gender to female. I don't know if it was because, like, was it that one nurse who just clearly fucking hated trans people and wanted to, like, rub it in my face? Was it somebody else who was like, hysterectomy, that means female. I think I should fix this. Like some dumbass doing some shit like that. I don't know. I don't know who did it or why they did it. I did report that this happened, and I was told that the person who did this was reprimanded in some way. I don't know if they got fired or if they only got talked to, but it wasn't okay. My surgeon was livid when she saw that somebody had done this. Like, I mean, she was professional. She kept it together, but she was like clearly very mad that somebody did this shit to me after like all of the other moments of transphobia that I had dealt with during my surgery and during my recovery. I did want to mention another thing, by the way, which is whenever I was bleeding a whole lot and I called them on the phone to let them know that that was happening, they called me ma'am. Like, come on. Like, I tell you my name is Oliver and you're going to call me ma'am? My voice sounds like this and you're going to call me ma'am. It's so silly. It's so goddamn silly that, like, medical professionals are not aware that trans patients exist. And it's like, okay, so let's say that, like, it's about 1 or 2% of the population, and that's not a small number of people. It's incredibly frustrating to me because that is not a small number of people. Like, about 2% of the population has red hair, and we don't, like, flip shit when we see somebody with red hair. We don't, like, not know how to talk to them, and we don't, like, dismiss their concerns. In fact, did you know that people with red hair react to anesthesia a little bit differently? And usually people with red hair have to have, like, I think a little bit of a higher dose of anesthesia. And that's something that a lot of doctors are aware of. But no, when a trans patient comes in, everybody is goddamn confused. So I saw my surgeon. My surgeon was mad that I had dealt with so much transphobia, and she reported some people. People got in trouble. And, like, I want to tell you guys this because, you know, not just to be, like, scared that some transphobia is going to happen while you're in a very vulnerable state medically and emotionally, but I want you to be prepared for it, and I want to embolden you guys and let you know that you can report people. You can find a surgeon who will have your back. And that, like, we do not have to put up with this shit, and you should not put up with this shit. It's not okay. Like, part of their job is to make sure that they are accessible to you. Like, if they are causing you distress and being disrespectful toward you because of your minority status, that makes your care inaccessible. It makes you not want to call. It makes you feel unsafe to call and ask questions. That's not what they are supposed to do. That is not what their job is about. Like, they are doing a medical disservice to you and to our community. If they did that shit to me, you know, I'm not the only trans guy who lives in my town. I know a whole lot of other trans guys who live in my town, actually. There's like 140K. No. Yes. Yeah, there's like 140,000 people who live in my town, and I know several trans guys who live where I live, and I don't want them to have to deal with the shit that I dealt with. And so, even though I didn't want to, and even though I worried that, like, they would ignore me or brush me off, I felt that it was important to type up that email and tell the patient complaint, like, employees what happened. And, like, I was really lucky, and I was really happy and relieved that they took me seriously, because I have had experiences in the past where I have dealt with transphobia in a medical setting, and that it has been taken seriously. I know it's hard and I know it's unpleasant, but if something like this happens, I really want to encourage you guys to speak up and do something, say something. And if you need help, there are very likely people who are more than willing to help you, because like I wasn't like ready or willing to type that shit up when I was just a couple weeks post-op and I wasn't feeling well. And like I got a whole lot of encouragement and I got a whole lot of help. So like lean on the people around you and ask for help. And fucking let people know it's not okay to treat trans patients like that. It's not okay. Like, going through surgery is already hard enough without the transphobia, and the transphobia made it so much worse. Okay, so I hope this video was helpful for some of you guys. If you have any questions, please feel free to ask in the comment section, or maybe like contact me on Reddit, user/trans_catdad. I'm an open book and I really want to like get as much information out for trans guys, trans masculine people as possible, just to like demystify a lot of these processes and help make them as accessible as possible to my brothers and my siblings, because I care about you guys. And man, like, trans people before me worked really goddamn hard to give me the opportunity to medically transition. And even though I'm disabled and a lot of the time I feel like I can't do a lot, I think like sharing my experience like this, maybe it'll help some of you guys. Sharing my experience and sharing what knowledge I have. So anyway, thank you guys for watching, and I will see you next time. Bye.